Hi, this is Dr. G, fellowship trained joint replacement surgeon practicing in Pennsylvania. Today I'm going to talk about painful total knee replacement. When was the last time you had knee replacement? Do you have a painful knee replacement? Are you suffering a lot from it? What are the reasons why you're having this pain? Because I can tell you that one of the happiest patients that I had to deal with are the ones that had painful knee replacement and ended up getting revision surgeries. But I have to caution you here. There's really no redo of knee replacement, meaning that we cannot replace the same primary knee replacement components in a knee that was already replaced. Because when you look at this model, when we're taking these implants out, it does not come off as easily as I'm doing right here, like this. No bone loss whatsoever. First of all, whatever the disease conditions that are causing this knee implants to fail is going to have destructive components to it that you're going to have destructions on the bones, joints, all the nearby structures. And when I take these implants out, I try to do a good job here, but it's inevitable that I take some bone out from your healthy bone when I take these implants out. Because I got to really chisel around at the points, and usually it's very well seated, and taking it out is no easy task. Um, and because of that, because the aforementioned two reasons why there are some destructions in the bones, we have to reconstruct with putting more metals on the components, and we gotta sometimes have to put a long rod inside the bone. So there are more metals that go into it. And because of all the instructions and when you do these revision surgeries, the plastic portions here usually are more constrained. What does that mean? Is that there are more plastic portions to it to provide stability. There is a little post that goes inside here and provide a stability, or sometimes what we have to do a hinge knee construct where this part and this part is joined together mechanically. That gives you somewhat unnatural feel to it. Not only that, when I go through the scar tissue and open it up, the incision is going to be much bigger and it's going to be more painful with the surgery. So it's going to be not only is going to be more painful, but it can also lead to faster failure rate with the revision surgeries, and it can also have other complications, more so than primary knee replacement, such as infection, blood clot, and even medical complications as well too. So unless you have real reasons meaning that you have an infection, implants are failing for whatever reasons, whether the implants are subsiding or loose, or you have unstable knee, meaning that the knees are um, having too much of a movement because it's not tightly balanced, and fractures around the implants. Unless you have those problems, I highly suggest against going through revision surgery. Again, there's no redo in revision surgery. It is completely different surgery, and it takes a lot out of you. Again, thank you for watching my video. Check out other contents and please share with your family and friends. Take care. Bye bye.